as part of the, again, the federal medical stations provided by Health and Human Services, but all done through the hands of New Jersey residents, which is phenomenal.
Honored. We wouldn't have the federal support as well, I have to say, without the gentleman to my left and his colleagues led by him. So thank you, Senator, again, for everything in general. Thank you. Where's our, oh, I love the flags too.
So I think what you'll see, Governor and Senator, are the actual medical equipment that are part of this facility are part of that federal medical station system.
Yep.
The hands that built this also were through local labor that were contracted again by the state, which is again the economy. You got money coming back into the state as a result of that effort.
You betcha.
And so that's also a good news story. And we'll see that, I think, as Lieutenant Colonel Park is really orchestrating the efforts on the ground across New Jersey at multiple sites. Dave working again with FEMA Region 2, who we support from a public works and engineering standpoint, the Health and Human Services and all the state agencies. And again, sir, this is a team of teams effort because, and we are, nobody's going to stop. We don't quit, and we're going to drive towards the finish line, wherever that is.
You betcha.
So,
and you mentioned it's union built, which is a big deal for us and for our state. So thank you for that as well.
If I could just point out, so as far as these convention center setups, I mean, all the heavy lifting was done by your state troopers and Mark and his team. So essentially what we've done is just kind of handed over the design template and the layout initially, and they've kind of done all the heavy lifting and the layout and installation of the facility. So that's kind of the model that we're following for the other two sites as well.
Great.
I think they're already starting on the next site at Edison. And then we're kind of focusing, I think, on the hospitals now that they've kind of told us to go out and assess and start work on those. So for those hospital renovations, we'll actually be doing the contract award and some construction.
This is reopening wings and reopening full closed hospitals.
and so Governor and Senator, if, again, the concept that we came in just very early on, simple solution to a really complicated situation where you could come in with essentially a COVID or a non-COVID environment, looking at compartmentalized solutions such as shuttered hospitals or dormitories or even hotel spaces.
Yep.
And then a much more open area, an arena-like facilities such as the convention center that we have here. But again, working very tightly and collaboratively with the health professionals to make sure that we also took into account the acuity of the patients that you're trying to take care of in these spaces. And so whether they be non-COVID or even COVID, you have to look at, you want this to be a step-down facility. So essentially those patients that are coming out of the duress or the fevers, and as they make their way down and they can step down, you could feasibly use a space like this as a COVID environment to allow them to finish up their quarantine period and then transition back to work or back to their homes, which is something that's under consideration across the state, sir. And again, to your team, they've been in it from the very beginning, leading the way. We are just an enabler, along with the other federal agencies in support of FEMA Region 2.
General, 250 beds?
In this site, at 250, Senator, but it could be scaled up. You could easily double the spaces inside, especially if you have family members that we're seeing in other regions. I covered down on the 12 state regions, all of New England, down through Washington, D.C. to the border of Virginia and North Carolina. So FEMA Regions 1, 2, and 3. And I'm watching all the different episodic alternatives that the states are using within each of those regions. Some of which are doubling up, others that are keeping them singular. But again, it's depending on the capacity that you want to expand within your hospital spaces. And we want to enable you to move fastest by providing the ICU capability and the acute care in the existing hospital footprints. And then how do you either divert, triage, and move folks to these other sites to enable you to move and provide those more critical care spaces?
Pat, how many days did this take? Maybe the general crew with us.
7 or 8, Charlie?
It's about right, sir.
Yeah.
And to that point, you heard Commissioner Percy Kelly yesterday talk about those 80 ER patients that were diverted. So when this is ready to go, an incident like that, triage them there, don't admit them to the hospital, that they would come here, and I think that will alleviate the pressures on our healthcare systems.
Maximum flexibility right now and capacity are the two sort of driving themes for us.
Right, Governor. I mean, and as you said, the patient administration and coordination, and I am not the medical expert, I'm your engineer.
Yep.
But working with the health professionals, health and human services, that's where we're starting to see, Governor, the transition of exactly that. Triage up front, and before you enter your facility, start diverting them to these other locations where the lower level of care can be provided. And if you need to step up acute care, you can do so. But again, it comes back to the state's ability to certainly field the experts and certainly the supplies that we all know are making their way through the system.
To the point of manpower and other support, Judy's hoping to have this going early next week, right?
Just talked to OMB, the
Yeah.
contracts are in place for the medical personnel to be on
Yeah.
board, so.
So I think we're trying as early as Monday get this thing up and running, so huge effort by everybody. I mean,
Well, the Army Corps is great as well,
Unbelievable.
and we appreciate the as well. But this is what the Army Corps is great at doing, harnessing the powers of the be to construct things, so.
Solving the nation's toughest challenges, that's our goal, sir.
Yeah.
And we're with you all through the very
By
end.
the time we're finished, you're gonna have 3 stars instead of 2.
Sir, I'm gonna find employment somewhere, whether I continue to do, I enjoy what I'm doing though. And,
You
cannot be
keep
done.
doing this, you may find 4. I wouldn't mind just walking down the back, if that's all right? Is that okay with you, Bob? I don't want anyone here to, Brenda, I'm worried about you.
I'm worried about me too.
Governor,
Hey.
it's our lead here, Mark Pellegrino.
Mark, sir, thank you. I'd normally give you a hug, but I can't today.
Prefer to do the walk.
So each one of these look like they're kitted out with the sort of a basic, very basic set here, right?
They are.
And then obviously we'll add to that.
Sure, I can add some stuff if you like.
Yeah, please.
So yeah, these rooms are 1 per unit right now. It's based on the federal medical station system. So we received those caches from the federal government, HHS, and this was built out. The walls were built out by the union workers here. The carpet's laid down to suppress some of the noise so that folks can sleep at night, the patients can sleep at night and get the rest that they need to help, to get healthy. The stuff that's inside each of the rooms came directly from that cache. There's a lot of wraparound services that were needed to get the place up and running. There's some showers, there's some extra toilets that were needed here, some sinks that are needed here so that we can have proper hygiene. So if we want to do a walk down here real
do
quick,
that.
I can point some of
I
it out
also want
for
to
you.
say Hudson County's in the house, and Sheriff, thank you for you and
Thank you,
the
Governor.
county
for coming
executive
to
and everybody
Hudson
for helping out here, man.
County. Hello, Senator. Mayor, how are you?
So the 250 rooms are broken down into pods. They're lettered A through J. There's 4 nurses stations here.
Yep, go ahead.
Okay.
Where are the stations? Are they down at the end or?
We'll do a loop and I'll show you one of the
Okay,
nurses stations.
fantastic.
It's kind of rudimentary, but this is what we have so that they have hot water. Each one of these sinks has a hot water heater in them, so we have hot water and cold water and soap right there. They don't have any underwater plumbing or underground plumbing here, so that's what we had to work with. We have the red waste, the medical waste, and regular garbage waste. They contracted services here for the red waste to be picked up on a regular basis. If you want to take a peek in this room, this one's kind of set up with the sheets and everything. Show you some of the different style beds that are in some of these rooms.
Got it.
Working on adding some other stuff to the room, such as trays, so that the patients can eat off and have their medications brought to them.
Right.
That stuff wasn't part of the cache, but the Department of Health folks that came in here to help get the place up and running identified some of the things that were missing from that cache, and we've procured those items that are on their way.
Fantastic.
One of the things that this place did not have was a ADA compliant shower, and they only have 1 floor drain in the whole facility, so they actually built an ADA compliant shower there. The entrance is on the other way. Those over there are the additional shower trailers that were brought in. The porta johns are still outside. There's a pharmacy here, a temporary pharmacy that's back behind the wall there, and food services as well. So food services will be supplied to the staff and the patients here on a regular basis.
Fantastic.
And then we can just wrap around this way. I'll show you a nurse's station. The Army Corps did a great job getting this place set up, the layout, ready for us, and then worked with the local agency here that runs the convention center on a regular basis to really get the layout complete, to maximize the space, and find locations for 250 rooms as well as all the support services and wraparound services. This is what a nurse's station would look like. There's 4 of them that are spaced out evenly throughout the floor.
Okay.
some other stuff coming in. We're not quite ready yet, so have some work to do.
We know we're a few days early here, I guess. Thank you for accommodating us.
The goal, as you stated, sir, would be a soft opening come Monday, bring in a couple patients and make sure that everything is here that needs to be here to accept patients.
Yep. These are just, is this utility work?
Some of them are just some utility storage areas. Yes.
You good?
Yeah.
Another nursing station here. We have limited space to work with at this particular facility. The next two get increasingly larger. Edison is going to be a 500-bed location, with the square footage that way much larger. And 250 here, 500 in Edison.
500 Edison,
And then
250 in
250 next
Edison.
to it, yes, sir. This area through here will just be the break area for the staff, the nurses, doctors, whenever they're gonna have their lunch and whatnot. There's a little break area there, and then there's a locked storage area for some of the medical supplies that need to be behind lock and key. There's a storage area back there. And then the last stop that I'll show you behind these walls will be where the administrative staff, the chief nurse officer, the chief medical officer, the dietitian, the social workers are all gonna have some space back here. Pretty limited space. I know we want to keep the social distancing, but I wouldn't mind if you popped in there and just thank the team that's working in there to build this thing out.
Where are you?
I'll go right in this door down here.
Okay, sir, how are you? How are you, man? Thank you, guys. God bless you all.
So this is kind of where all the magic is happening here, sir, and the team that got this all to happen is in
All
there.
right, folks. God bless you all. Thank you. Great work. Great work, everybody. Got Senator Menendez with me. And I just want to say thank you to each and every one of you. Extraordinary effort. Of course, this is only the end of the beginning as opposed to the beginning of the end. We start opening up for business on Monday, so God bless you all and thank you for everything you've done to get this going. I know the senator joins me in that regard.
Exceptional, thank you. We're hopefully gonna save lives as a result of it, so.
Amen. God bless you all, okay? And we're gonna win this thing.
Thank you, sir.
Let there be no doubt about it, all right?
All right.
Thank you, Governor.
Thank you. Why don't you guys go ahead?
Yes, sir.
Great job, man. Thank you. At some point when I can, I'm gonna give you a hug. Yes, sir. Do that today. Yes, sir. I don't think so. Unless Callahan thinks otherwise.
Thank you. Gov, did you meet Sean for comments?
I did. I bet you. Is he?
He's over here.
Okay.
He's
Go
hiding.
ahead. I gotta get you on one thing that's private, but, that's okay.
Yep.
We could do that maybe outside. Okay. Where's Mahan? Do you know where Mahan is? He's in the back. Okay. Hey, sir.
Governor, how are you, sir?
Nice to see you.
Nice to see you. Doing a great job.
Thank you very much. You know Senator Menendez also doing a great job.
Senator, how are you? Good. How are you? Nice to see you.
I don't think we're doing any press here, although I'd defer to the senator. I think we're doing our regular 1 o'clock, right? Anything you want us to do here? Or?
Do you have any comment on what you've seen?
I mean, just to say the obvious, it's incredible. The Army Corps, General Milhorn, Lieutenant Colonel Park, have been extraordinary partners in their teams. The troopers under Colonel Callahan, FEMA. We wouldn't be here without our federal delegation, and God knows we need it. And so this feels like it's ready for, as was discussed, a soft opening on Monday, and we could start to populate this. We're contracting for the workers we're going to need, the additional supplies from the Department of Health. And this is a marathon. We're going to be in this for a while, and I don't know where we'd be without the senator and his colleagues, because we need the federal government more than we've ever needed them before. Anything you want to add?
Well, no, I'm Governor, first of all, you made a lot of tough decisions, and I believe those decisions are going to save lives. The Army Corps of Engineers, just a fantastic group of people, and we work with them normally in much better circumstances than this, but just shows what they're capable of doing. Appreciate the Colonel and all of the troopers and all of the contractors that have put it together. And you know, our goal is to have the maximum capacity available. And I'm glad that the federal government responded to our requests to both FEMA and to let us use the Army Corps for these purposes. You know, we expand capacity and we pray every day that we don't need it.
Yep. Amen to that. So thank you all, and again, thanks guys, great job. General, bless you. We'll see you around, I suspect, sooner than later. Lieutenant Colonel, God bless you and your team as well. Thank you for everything, and Pat, to you and your colleagues. All right, thank you all.
We're actually working on that step-down plan, whether that's low acuity patients in existing hospitals already, or whether we triage at the regional hospitals and bring them here rather than admitting them into a hospital, that they actually would become admitted here.
How do you know for sure that someone you admit won't be COVID positive?
You know, I think that, but I think to the general's point, that we still have the capability to cohort those patients, that you saw the size of the magnitude of this medical station. That's a possibility, a contingency that we're prepared to address, Brenda.
Okay. So if you're putting 500 down in Edison, from what I hear, so have you figured out the fourth location yet?
It's actually the third, so we doubled up Edison.
Right.
So it'll be here, Edison with 500, and Atlantic City Convention Center.
So there
the
will
other
be a fourth.
250.
It'll
There
be-
will not. We doubled up Edison because of the central nature and the
Gotcha.
strategic placement of it.
Okay. And how soon is it before Edison gets up and going?
You know what? I think they're down there now. It's kind of that cascading effect of dominoes effect, working our way through from the north, central, south, just like this virus is. So I would imagine, seeing how they worked so well in the last 7 days, I would imagine it's probably pretty short order they're on that.
Do you know what the staffing complement here is going to be?
I think here is going to be a total of 99 medical staff, from medical director to, I think, 24 RNs to all the wraparound services, social work, respiratory therapists. I saw that list yesterday. It's as comprehensive as can be.
So it's like a 1 to 2 point whatever. Ratio?
Healthcare to patient ratio, yes.
Are you going to be bringing in some complex machinery, or because this is pretty Spartan looking?
Not at this juncture, but it will. We could, if we need to ramp this up to an intensive care. To the general's point, we're prepared to do so.
Because now it looks almost like a recovery room kind of.
Yeah, it's
vibe.
I would say it's rudimentary, but the care will be the same as it would be in any hospital in the state of New Jersey. I'm sure of that.
Cool, thank you.
Thanks, Brent.
No, it's all right.
Whichever way.
So you had said you were ready for a soft opening Monday?
Yes, so
What's going to happen?
so I'm tracking that the medical staff, mostly from the National Guard, will be coming in on Sunday, and then this facility should be operational by Monday.
So how are you going to get your patients in?
Well, it's supposed to be almost a step-down kind of facility where it's not meant for walk-in patients. So for non-COVID patients who are kind of on the mend from other operational hospitals, we kind of relayed or transferred to this location.
Do you know if there's a triage set up from the level 1 traumas, or are you going to be looking at, for example, who's on divert? How are you going to manage this?
Well, so I would probably defer that question to the HHS and medical professionals that
Gotcha.
are kind of developing that plan.
Can you talk about what was involved in the logistics of getting this place up and together?
Sure. So initially, the state had to request the actual federal medical station, of which there was a limited amount. So New Jersey was fortunate enough to get 4 of those federal medical stations. On top of that, there were some additional, what we called wraparound services, shower trailers, hand washing stations, things of that nature that kind of had to be coordinated and kind of installed. So the state troopers and emergency management folks, along with FEMA and HHS, kind of coordinated all of those additional necessary equipment to get that in place with the facility.
I'm sorry, I'm a little bit confused on the patients who are going to be here. You say they're non-COVID, but they're recovering, or is it going to be a mix of different types of patients?
No, so, and I think I'm kind of speaking out of my lane here, but as far as the original intent here was for non-COVID patients, so patients that were not positively confirmed as having the virus. As far as the kind of the step down and the recovering patients, I think the intent is to kind of relieve some of the space capacity within the operational hospitals and bring those patients to these locations.
Thank you. The gentleman who gave the tour, do you know his name?
Mark Pellegrino.
Mark Pellegrino.
Yeah, so he's kind of been in charge of this whole operation. He's a state trooper for New Jersey with the incident management team, and he's actually going to be in charge of the follow-on setups for the other locations as well. So,
And that was General Milhorn who was with you?
Major General Milhorn, yeah, he's the North Atlantic Division Commander for the Army Corps of Engineers, so he's my boss.
And Mark's title or rank?
So I
You got it? Okay.
but no, his team has been fantastic, and the state troopers have kind of been the lead as far as the on the side.
You said before, if I got that correctly, that the state troopers were doing most of the building work?
So they, the kit came in like these white boxes and containers that they had to kind of remove all the equipment that you see there, as far as like the cots, the beds, and all those things, with the help of the facility laborers and the National Guard. Labor, they were able to kind of pull that out, inventory it, and set everything up. So yeah, they were kind of in the lead for the actual installation of this whole facility.
What's a basic room outfitted with?
So it's a variation of 250 beds, along with the necessary kind of medical equipment and supplies that go along with it. So it's supposed to be meant for kind of like a field hospital type environment.
Who does your laundry?
I don't know. There is an area for soiled linen. I'm not sure who does the laundry.
Okay.
Thank you.
You're welcome.
Thanks a lot.